Have you ever wondered if the pills you take every day might be doing more harm than good? After 70, every year is a precious gift, a chance to cherish time with loved ones, explore new hobbies, or simply enjoy a quiet morning with a cup of tea. But some common medications can quietly steal away that vitality. Today, we're diving into 7 common medications that could harm seniors. I'm here to walk you through this with care, sharing simple insights to help you live your fullest life. Let's make sure you're informed and empowered to stay healthy and strong. Medication 1. Over-the-counter pain relievers first. Let's talk about over-the-counter pain relievers, like ibuprofen or aspirin. These are often grabbed off the shelf for aches and pains, but they can be risky for seniors. They can irritate your stomach lining, leading to ulcers or bleeding, especially if taken regularly. For some, they might even strain the kidneys, which work harder as we age. Imagine Nancy, a 72-year-old who loves gardening. She started taking ibuprofen daily for her knee pain, but soon felt nauseous and weak. Her doctor found her stomach was irritated and switched her to a gentler option. If you're relying on these pills, talk to your doctor about safer ways to manage pain, like physical therapy or low-dose alternatives. Medication 2. Sleeping pills next. Let's look at sleeping pills like zolpidem or other sedatives. Trouble sleeping is common as we age, but these medications can cause dizziness or confusion, increasing the risk of falls. Falls are a big concern. They can lead to fractures or a loss of independence. Picture Tom, a 68-year-old retiree who enjoys morning walks. After starting a sleeping pill, he felt groggy and tripped on his porch, spraining his ankle. His doctor suggested a bedtime routine and melatonin instead. If sleep is elusive, try warm milk, a quiet evening, or chat with your doctor about non-drug solutions. Medication 3. Anti-anxiety medications third. Let's discuss anti-anxiety medications like benzodiazepines. These are often prescribed for stress or anxiety, but they can cloud your thinking and make you unsteady. Over time, they might even affect memory, which can dim the joy of daily life. Consider Ellen, 75, who took these pills to calm her nerves. She started forgetting small things like her grocery list and felt foggy. Her doctor helped her taper off and try relaxation techniques like deep breathing. If you're feeling anxious, ask about counseling or gentler options to keep your mind sharp and clear. Medication 4. Blood pressure medications. Number 4 is blood pressure medications, like diuretics or beta blockers. These are vital for heart health, but some can cause dizziness or low energy, especially if the dose isn't right. Low blood pressure can make you feel faint, risking falls or fatigue that keeps you from enjoying life. Take George, 70, who loved dancing with his wife. His blood pressure pills left him lightheaded, and he missed dance nights. His doctor adjusted his dose, and he was back on the floor. If you feel off, don't hesitate to ask your doctor to check if your medication needs tweaking. Medication 5. Antidepressants 5th. Let's talk about antidepressants, like older tricyclics or even some newer ones. These can lift your mood, but side effects like dry mouth, constipation, or even heart rhythm changes can sneak up on seniors. These can make daily tasks harder and sap your energy. Picture Sarah, 73, who started an antidepressant but struggled with dizziness and tiredness. Her doctor switched her to a different type and added talk therapy, which helped her feel like herself again. If you're on these, check in with your doctor regularly to ensure they're still the best fit. Medication 6. Antihistamines. Number 6 is antihistamines, often used for allergies or colds. Over-the-counter ones, like diphenhydramine, can cause drowsiness, confusion, or even bladder issues in seniors. These can make it hard to stay active or enjoy time with grandkids. Think of Margaret, 69, who took an antihistamine for her allergies but felt so groggy she missed her book club. Her doctor suggested a nasal spray instead, and she was back to her lively self. If allergies are bothering you, ask about options that won't cloud your day. Medication 7. Diabetes medications. Finally, let's cover diabetes medications like insulin or sulfonylureas. These help control blood sugar, but they can sometimes push it too low, causing shakiness, confusion, or even fainting. This can be scary and dangerous, especially if you live alone. Imagine John, 71, who loves fishing. His diabetes pills cause a low blood sugar episode, leaving him shaky on his boat. His doctor adjusted his dose and taught him to monitor better. If you're on these medications, work closely with your doctor to keep your levels steady and safe. There you have it. 7 common medications that could harm seniors, but also ways to protect your health and keep living vibrantly. Each year after 70 is a treasure, and you deserve to feel your best. Reflect on this. Are any of these medications in your routine? What steps can you take to stay safe? Drop a comment below to share what you've learned or how this makes you feel. I'd love to hear from you. If this video helped, please give it a like, hit that subscribe button, and share it with someone you care about. Here's to thriving in your golden years. Stay well, stay wise, and keep shining.